All right, let's get serious about COVID. Ontario continues to break records as cases of COVID-19 surge across the province. Here in the capital, our recent numbers show our highest one-day spike in cases in the last week and a half. Although the trend has been quite good until now, here locally anyway. So were restrictions eased too soon? And looking at the latest projections, will we really be seeing up to 6,000 cases daily by mid-December? That's what we heard yesterday. Let's get the take of our friend, University of Ottawa epidemiologist, Dr. Raywat Deonandan. Dr. Ray, it's always good to see you. So much to get to. Let's start first with the projections. We've heard projections before since the pandemic started. We never reached those numbers. Why should this one be taken more seriously?
Well, the most recent numbers we exceeded, actually. They anticipated 1,000 cases per day at a peak, and now we're at 1,500. So we should take it seriously. But of course, these models are always wrong. There's no adage, every model is wrong, but some are useful. So what does this tell us? It tells us that the worst case is pretty bad. All right, so what I found surprising about this press conference was, despite the dire predictions, it was not paired with an announcement of additional tools that will be deployed to help assuage those dire predictions. So I'm at a loss about what to think about what we're doing next. But it's not looking great, right? But it's not looking great across the entire country and across the entire Northern Hemisphere, for that matter.
Yeah, well, in fact, there was pushback from the Premier, right? After those documents yesterday showed that the people who advised the Premier, and in particular Dr. Williams, didn't see their recommendations rolled out accordingly. The Premier, though, saying yesterday, I'm going to speak to Dr. Williams and the company today, so we may expect more. How necessary are more measures? Should we be back in lockdown even here in the capital?
I wouldn't say back in lockdown, but more measures are needed. What those measures are is debatable. At the very least, we need more public health assets. I've been arguing for a long time. We need, of course, better testing and more strategic testing, but a lot of contact tracing. I mean, a lot of it, especially backwards contact tracing like they do in South Korea and Taiwan and Japan, where they have an open economy, but they have COVID around them, but very few cases. Backwards contact tracing takes political will, resources, and a bit of time. So we can do these things. It takes, again, the will to put them in the field. But to get there, we'll probably need some degree of restrictions, unfortunately, for a couple of weeks to get the numbers back low. But again, anytime you restrict, you're going to have to invest in more assets so when you open up again, the cases don't overwhelm you once more.
You know, the public is hearing, hey, we only had, a couple of days of 20 cases here in Ottawa. It's a different story up in the, Peel and Toronto. We did have 91 yesterday, which, again, we are always being told, especially by, people in the medical field like you. Look at the 7-day trend. It's looking pretty good here in Ottawa. Still, we need to, is this a preventative measure with these added restrictions?
Yeah, I mean, the restrictions I'm calling for aren't restrictions. I'm calling for more assets. But if we were to restrict at a provincial level, that would be good. Remember, even though we're doing okay in Ottawa relative to Toronto and Peel, nothing prevents people in Toronto and Peel from coming here and reseeding us. That's the nature of these explosive infectious events. In Ottawa, our cases are down-ish. Our reproduction number is holding at somewhere around 1, so we haven't got extreme exponential growth. And our test positivity rate is, I think, under 3%, so things can stay open. That's great. But our hospitals have many COVID cases, I think about 60 cases, and including some younger people. And that's not a lot by some people's standards, but this is an explosive infectious disease. And in the USA, it's the third biggest killer after heart disease and cancer. So you don't want your third biggest killer in any capacity in the hospital system. So it's still, we have to be careful, right? Ottawa is doing well, but we have to be careful. And so I'm hoping we can get the cases in other parts of the province down low enough so that when we deploy these additional public health assets, we can keep the numbers down, especially as the holidays are coming.
Have you lost confidence in the politicians with their decisions of late?
Yeah, I was a very naive fellow back in the spring. I thought we had a plan. I thought everyone knew that we had to invest in these public health assets, and yet something magical happened in the summer where no one did any of those things. And so my eyes are opening up. I'm growing up a little bit. I'm losing a little faith in our leaders, absolutely.
What about the people? We're getting mixed messages from the science community, the politicians. We're a little confused. What's your message to general population this morning?
Yeah, I get it. The people are suffering a lot, and Canadians in general have been so good, especially compared to the USA and some European countries. People need to understand that regardless of what the politicians say, and even what the scientists say, one thing remains true. It's always in the hands of the population to control the spread of this disease. All we have to do is limit the number of exposures we have per day and per week. If we don't interact with people, We can't get it and give it to other people. It's as simple as that. That's how infectious diseases work.
You're saying a quiet holiday season, please, is the message, I'm guessing.
I'm saying some people have to socialize for their mental health purposes, but ask yourself really if that's you. You know, if you don't have to go to that office party, don't do it. If you don't have to go to someone else's house, don't do it. If you have to see your grandkids, you have to see your grandkids. I get that. Some people have to see each other, but most of us don't. So, you know, be responsible.
Should we wear a mask if we want to see our grandkids?
It depends. If you know, do you live with them? If you're indoors with someone you don't typically live with, I'd recommend it.
Okay. Dr. Raywat Deonandan, we always appreciate your insight. Thank you, sir.
Thank you.